Meditate, manifest, invest in you. Join me on my spiritual journey as I elevate myself and like-minded listeners to a higher level mentally, physically, and spiritually. Thank you for listening. This is Black Hippie Lounge, and I am your host, Chanel. So good evening. Welcome to Black Hippie Lounge. I'm your host, Chanel. And tonight's episode is titled Dual Cases Part 2, featuring my good friends and current nurses in both Boston and North Carolina. Their names are Estelle and LaShonda. So tonight they're going to give their perspective of healthcare from a Black woman's point of view and give us some insight. So Estelle, LaShonda, welcome. And thanks for joining. Do you guys want to give us a little synopsis about yourselves and why you were interested in tonight's episode? We'll start with you, Estelle.
Hi, Chanel. Hi, LaShonda. Thank you for inviting us to join the podcast today. I'm really happy with being a part of this today, and I'm really proud of the work that you're doing, Chanel, with Black Hippie Lounge, creating this really vibrant space for us to discuss new ideas. And a little background about me. I am currently a nurse working in Boston, and I think right now is such an important time to be talking about healthcare, considering all that's going on with this pandemic. And so I have a lot of ideas, and I look forward to sharing those today with you all on the podcast.
Thanks. All right, you, Shonda?
Hi. Can y'all hear me?
Yes.
Yeah.
Okay. I'm LaShonda. I am a ICU nurse here in Charlotte. I'm excited to join the podcast today. There's a lot going on right now, and everything is scary, and I look forward to seeing what everyone has to say.
Nice. Thank you guys so much for coming on. So we just have a couple of questions, and it would be good to get you guys both perspectives, especially because Shonda, you're down south versus Estelle, you're up here up north. So I'm sure it's a little different, how things are going right now in the two different types of hospitals that you guys are in too. So the first thing I want to ask is, what has your experience been like as a Black nurse? How long have you been a nurse, and why did you choose to pursue this career? I'll start with you, Shonda.
I've been a nurse since 2011.
Okay.
Yeah. So down here, in Charlotte, first of all, I've been a nurse in Winston-Salem, and then I came to Charlotte. Winston-Salem and Charlotte, to me, is like two different worlds. Here in Charlotte, it's more, you don't see a lot of African-American nurses.
Okay.
Versus in Winston-Salem, you see a lot of them. You are treated differently, maybe because it's closer to South Carolina, but it's not a lot of Black nurses here in Charlotte. You see them in other areas, but not actual RNs.
Okay, also like CNAs and...
Yeah, it's more like CNAs. You have a lot of, they do, I guess you could say specialties like CHG doctors, but majority of them are like African, but like African American women, it's not a lot here in Charlotte.
Okay. And what made you want to become a nurse?
Well, my mom was a nurse.
Okay.
And I initially thought it was because I would say job security, but I will say this: I have been two different companies where I was laid off, so I can't really say job security anymore.
Okay. All right, thank you. And then you're in school too, right, to be a nurse practitioner, right?
Yeah.
Okay. All right. So Estelle, what's your experience like being as a Black nurse?
Similar to you, LaShonda, I work right now in Boston, and the hospital that I'm at, it's not really diverse. I mean, you'll say we're in the city, so you do see, nurses of color, but it's few and far between. I in my department in particular, I've been in this particular department since January, and I'm one of 2 Black nurses out of like 30 something nurses. So it's like you really don't see that often, and it does kind of have an impact on you as a nurse to not see people who favor you and race. It could be a challenge, and you're just kind of coming up against a lot of misconceptions with these nurses, predominantly white nurses, who might have their own ideas of who you are, and even the patients who sometimes question your education level, and some things that that come up, like, why are you asking me when I graduated or where I graduated from? I'm a nurse.
Right.
These things come up, yeah.
Right. And why did you choose to pursue this career?
So similar to LaShonda, my mom's a nurse, and the job security was definitely a pull. I had my son, and I, really found that my maternal instincts kicked in, and I wanted to provide. So yeah, it just seemed like a natural fit to do something to give back and, longevity with a career.
Okay. So the next question is, why is it important to have Black female nurses? Start with you, Estelle.
Well, just to have some kind of representation, I think a lot of times when we're thinking about career options, when we see people doing it who look like us, it makes it more attainable. And so I think for the next generation coming up behind us, they need to see more people who look like them doing this kind of work so that they know they have a place. And also, because of the healthcare disparities in this country, we need advocates from our background to advocate for us, who know what our needs are in the community, so that we have a seat at the table. We have somebody who can speak up for us when, these disparities come up. So I think that's where the most important issues lie, is having people who can represent you.
Right. LaShonda, why do you feel like it's important to have more Black female nurses in healthcare?
I agree with Estelle. I feel like someone that's Black, they'll feel more comfortable with having a Black nurse. They can relate to them. They are more. They're more willing to be compliant with their health versus someone that's just, they just tell you, but then they're just like, I really don't know about that. Because it's a lot of, our community have a lot of health issues. And in this field, I feel like that they tell you, you have diabetes, you have hypertension, you have all these things. And it's like, okay, I have this, but I'm not gonna listen, because they don't tell you like the scary stuff. They don't tell you they just tell you, you will die, versus, if you follow this plan. I feel like a Black nurse will take care of their own more versus someone else from the outside telling us. If they see it like, because I get it all the time. It's like, when I see like just a random person, you're a nurse, I'm so proud of you, and they don't even know me.
Right.
Mm-hmm.
So I think it's more like the comfort level. If they hear it coming from us, they're more willing to comply versus someone just telling them, and they'll be like, okay, whatever.
And you also feel like let me know if you guys agree, but it's also like the tone too, and like the attitude of the person to definitely, help the patient, whether they're going to listen or not. Because if someone's treating you a certain way or judging you, then already you're not going to like listen to what they're saying.
Yeah, like I had that come up recently, where it was like I had a good rapport with a patient who was a Black woman, and then the white nurse who was like going to take over for me, she kind of like brushed off the woman's concerns in a way that, the patient was comfortable with me. And it's like, you just ruined the whole vibe by coming in with that perception that her pain level wasn't what it was. Like, and we can serve as advocates for patients, because a lot of times they think our pain threshold isn't what it is. It's like they don't believe you. And
Right.
we need people to be like, no, what she's saying is what she's saying. Believe her. You know what I mean? Like,
Right. Because isn't that what you learn in school anyway? That you're supposed to go with whatever the patient says their pain level is. You're not supposed to make that decision for them.
Or to like undermine them, because it's just like we had a good flow, and it's just like when she came in, she was casting doubt on the woman's, symptoms, and it's just, we need more people who understand where we're coming from,
or who are willing to. You know what I mean?
Yeah.
Because a lot of times our, like, what we need or what we feel like we need, it get brushed under the rug, like you said, and I feel like they don't take us serious, because I feel like, even with myself, I haven't went to a physician, and I went to her for my migraines, my high blood pressure. She like legit told me I had to schedule another appointment for each problem I had. I don't have that kind of time. And my whole thing is, like, I work in the ICU, I work with stroke patients. If my hypertension is causing my migraines, that can lead to me having a stroke. Right. So I'd rather fix this hypertension now versus waiting down the line when I'm a patient in the hospital.
Right. Yeah.
And when you do that, you create a space where patients don't feel like they can really say what's going on. Like, I mean, fortunately,
they'll be afraid to say
it. They might hide it. They might just, downplay it. They might just feel like nobody's going to take it serious. And that's not right. That's not what healthcare should be.
Right. Well, that makes sense. You kind of get that attitude of just like, forget it. I'll just keep it to myself kind of thing.
Yeah.
Yeah, I noticed the gap in, like, the way African American people are treated versus the way white people are treated. Like, we hardly ever discharge people home from our unit, but when we do, and when we get those, like, surveys that they have to do that, it's just like, you can see the difference. And I have seen, like, a lot more African American people end up coming back to the hospital for the exact same thing because something was missed.
Yeah, that's true.
And the way, like, insurances work up, if they come back within a certain X amount of days, then the insurance company is not going to pay for it. The taxpayers have to pay.
Right. And I think a lot of patients don't know that. They don't know that part of the system.
Right.
No.
Yeah. Those are good points. All right, so the next question is, has your work and school experiences made you change your views on healthcare and how you take care of yourself? We'll start with you, Estelle.
Going through school, it's like you learn so much about the different body systems and all that. And it's like you really learn about being your own advocate, because I think once you understand, you have like health literacy, you're able to understand where your needs are and how to speak up for yourself. And I think that's something that we really need to educate the community about, is like just being mindful of how to take care of yourself. I don't think a lot of people have a good understanding of how the body works and of how to take care of themselves outside of, the healthcare system. And I think that's something that we really need to start bringing the point home, is like nutrition is a big thing, and just because of the circumstances, the way things run in this country, oftentimes people are at a disadvantage and they don't have access to a lot of resources. But from what we learn in school, we need to learn how to share that in a way that is relatable to them in their daily lives, and how to manage their health before it gets to a point where the healthcare system has to do it for them. Right. So I think just becoming an advocate and just kind of understanding where you can get more education, more understanding of how to take care of yourself before you get really sick.
Right. Shonda, what about you? What's your experience been like? Or has it made you change the way you view healthcare and how you take care of yourself?
Yeah. The way I take care of, like, my patients, I look as if it's my mother or my sibling or myself. I try to, like, educate them as much as I can, because a lot of our people don't know. They just don't know, and no one has sat down and explained it to them. So if you continue to, I feel like if you continue to like give them that information and give it to them and give it to them and give it to them, they'll be more willing to comply versus coming back for the exact same thing.
Right. And sometimes not even
but
what they're coming back for, right?
Right. And then not only that, as far as myself, like when I go see my primary care physician, which you probably know now, but I don't off gate like, oh, I'm a nurse, I know this. I let her do her job, and then I tell her if she gets to the point where I feel like this is not working, I'll either switch or I'll be like, okay, this issue really needs to be solved, so I'm willing to see someone else. Because I have a son, I have to be here for my son.
Right.
So that means I have to take care of myself. And like, even with the past 2 years, it's been crazy with school and dealing with everything else. But it's like, I overall did this for him, and I want people that are the same color as me to like, if me, a single mother with basically no help, can do this, like, you can do this too. You have to be dedicated to
Right.
it.
Mm-hmm.
Yeah, it makes sense. You guys both actually have that in similar. You guys both are nurses, and you guys both have a son. So yeah, those are good points though. So do you feel like as nurses, it makes you want to stay more on top of your health as far as like making sure you schedule your annual appointments and like stuff like that too?
Yeah, because you have to be the example, and it's like, following through on things that are not feeling right early,
Right.
But I think sometimes too, as nurses, we kind of feel like, I don't want to make a big deal of things because you know how it can get, but you still want to be the example though.
Right. So I guess finding that balance of when to go in and when to just kind of self-care.
Yeah.
Yeah, that makes sense.
Yeah.
Okay, so one more question. Any suggestions for young Black women who want to follow in your career path, or as far as like advice for schooling, like how should they? You have like, say you have, for example, a young woman, she's a freshman in high school and she knows that she really wants to be a nurse, but she's just not sure where to start, what she should be doing for herself. What advice would you give her? We'll start with you, Shonda.
Well, I will say this. It's a lot cheaper doing it through a community college, a whole lot cheaper, because you will get in a lot of unnecessary debt. And if you go through a community college starting off, just by the financial aid that they offer, you're more likely able to pay for it without coming out with loans. Then you can go online and get that BSN. Like right now, nursing, like going to nursing school, it's not as competitive as it was when I initially started, because there was a wait list, and I had got a whole different degree before I even got into nursing school. So I would say start at a community college and get in that way, and then like go online and do the BSN, and then continue to climb up, because I think like the financial aid or like the loan cap is like $60,000. So yeah, I mean, you can do it. I know people that like did it that way, and a girl that graduated last August with her NP. She's a CHG doctor now, well, a CHG NP, and she came out of like grad school without any student loans.
Wow, that's amazing.
So versus me,
you and everybody else in society,
but yeah, I say
our student debt.
Right. I'll say, like, be willing to start small and work your way up, because a lot of people that's going to the 4-year colleges, they're not, I mean, to me, based off, like, pay-wise and from what I know and all the systems the healthcare systems I work for, whether you have an ADN or a BSN, a lot of those hospitals, those major hospitals, they pay the same. And then they just require you to get your BSN within an X amount of years.
Right, and you can do that online.
So if I would have known that, I could get an ADN and then go back for my BSN. And mind you, I started nursing since I was a nurse in 2011, and I came here to Charlotte in 2016. And when I found out nurses here made the exact same thing that I made, and I have way more experience than them, and I have a bachelor's on top of that, I was like, no, that wasn't right. And then you have new grads coming out making the exact same thing. So I feel like if you start from the bottom and work your way up, especially now being it's not really competition, like they're accepting students left and right. So
I totally agree.
It'll be more easier.
Yeah. I also would recommend like any like high school student who's like interested in nursing to volunteer at a hospital, really get a feel for what the profession entails. Maybe interview some nurses if you get a chance, maybe just kind of get a feel for what it really is. Get a job as a CNA if possible, or just so you could see firsthand what it takes and what specialties you're drawn to before you make that final commitment, I think. But I agree with you that, the associate degree is definitely a great option. You're cutting down on your debt. We need nurses left and right. There's a workforce that is, getting older. It's a profession that's going to keep bringing on new people. So you do not have to go into a whole bunch of debt to become a nurse. I agree with you all the way with that, LaShonda.
Right.
Yeah.
Yeah, that makes sense. Definitely, what both of you guys are saying. The goal is to just try to come out with as little debt as you can, basically. And like you said, you kind of start small and build your way up. There's no rush. You can always keep going.
Mm-hmm.
So yeah, thank you guys for that. So I guess to wrap it up, do you guys, just based on how things are at both of your jobs, do you have any type of suggestions for people right now as far as like coronavirus? Like any tips of how to stay healthy or what they should be practicing? I know we're supposed to practice social distancing, and I know up here, at least in Massachusetts, they've told people that they should be wearing masks. So I guess, do you guys have any other suggestions for people concerning the coronavirus? We'll start with you, Estelle.
Well, just follow the guidelines, the hand washing and the social distancing, like you mentioned. And also just being like healthy at home too, like making sure your immune system is on point, because a lot of these viruses can attack a strong immune system. So just making sure you're on top of your vitamins, you're on top of your self-care, you're, eating right, and getting outside and doing some exercise if possible, but, obviously keeping those distancing guidelines. But it's just like, I think as a country, we really need to understand how to take care of our bodies so that we can understand how a virus can attack. And that's something I really am becoming more passionate about as I'm seeing this, pandemic, like on the news daily. It's, you're seeing the numbers of how many people in our community are dying of this virus. It's just, we need to get better about taking care of us. And really, those of us who have that knowledge to share it with others, because it's bad and it's going to get worse.
Right. Yeah. The number of African American people who have died.
Yeah.
Up here is very high. I saw that on the news too, and I'm sure down south too. The numbers are high.
Yeah. Yesterday when we were going over the numbers at our evening huddle, like in North Carolina, 44% of the people that has passed away from the coronavirus is African American.
Crazy. And there's so many factors of why those numbers are high. You know what I mean? We could go on and on about that, but definitely, like you said, both of you said, just like having the knowledge and taking things. I think the biggest thing is like people need to start taking it serious.
Oh,
I think a lot of people do kind of just brush it off and think it's a joke, or I don't have to, I'm fine. I remember in the beginning there was this theory that Black people couldn't get it. People were believing that, and it's like, even if that is just like, it's your life, so take precaution as much as you can.
Yeah.
Like you said, you're coming home to your family. There are kids, and you don't want to infect other people or just infect yourself. So the best thing is to just be safe and sorry, I would say.
Yeah.
All right, guys. Thank you so much for coming on. I'm gonna end with a quote that I feel like kind of ties into this topic and kind of what you guys were talking about. The quote is, "Black women can do anything. We've proven that time and time and time again." And that is from a woman named Tarana Burke. She's the civil rights activist who started the Me Too movement. And I feel like that kind of just highlights or supports what you guys talked about today. Just how, Black women, we're so strong and we can do anything that we want to do. And we can be a strong force in any field, but especially within healthcare, and that we need to just keep educating ourselves and each other and supporting each other, and trying to get some more Black women nurses, more Black women in healthcare. We want to see more, like you said, Estelle, more representation, and like you said, Shonda, also just like having that person that you can feel comfortable talking to, so I think that's definitely an important factor. And I thank you guys so much again for offering your experiences and your insight to this topic. I know you guys are probably very tired from working out there on the front line, and we definitely thank you guys for that, just putting yourselves out there, and just know that you guys are definitely appreciated and admired for your work. So, round of applause to you guys.
Thank you for having us.
Thank you.
No problem. Like I said, thank you guys for coming on. And this is Black Hippie Lounge. Listeners can follow and listen on any social platform like Instagram or Twitter at Black Hippie Lounge. And this episode will be available on all platforms tonight. So thanks again, Estelle, and thank you, LaShonda. You guys have a good night.
You too. Thank you, Chanel.
Okay. No problem.
Thanks, Chanel.
Good night.
Good night.